Hey everybody, welcome on the call. If you are live, just let me know if you can see me and hear me okay. And if you're catching the replay, nice to have you along. So my name's Jessie Mundell. I am a prenatal, postnatal personal trainer and a kinesiologist. So I specialize in coaching women in pregnancy, early postpartum, and then moms in general. So you guys asked some really fantastic questions that I'm excited to get to, excited to chat with you about all this: core, pelvic floor, diastasis recti, how to breathe effectively when lifting heavier weights, what to do about incontinence, and a big one, are Kegels the answer, or is there other stuff we can do? So again, hey, if you are jumping on live, let me know that you're here. Say hello. Let me know where you're tuning in from. I'm in Calgary, Alberta, Canada. I don't know if we have any more Canadians in the group. I did see some familiar names though in your group when I was searching through your questions last night. So nice to have you all on. Let's dive right into it. Okay, so we're gonna start with Sarah's question. Sarah asked, I only realized recently that I have a diastasis recti. So she's 3 years postpartum. I have been doing corrective exercises with some success. What are your recommendations for breathing during heavy lifts? I've been using piston breathing methods for deadlift and not aiming for 1 rep max. So excellent, Sarah. This is great news that you actually know what piston breathing is, and I'll talk through that a little bit more. So first of all though, Sarah noticed she has diastasis recti, 3 years postpartum. Really common. Diastasis recti is actually a normal function of the body in pregnancy. So let me explain diastasis recti in case that word doesn't mean too much to you right now. So diastasis recti is when the abdominal muscles down the front of the belly, there becomes a separation or a gap between those rectus abdominis muscle bellies. So you can think our six-pack muscles that run down the front of the belly. They're the most superficial abdominal muscle. There's this connective tissue called the linea alba that runs from your sternum all the way down to your pubic bone along the front of your abdominal wall. The body's really smart. In pregnancy, this connective tissue is going to get more lax. It's going to get a bit more thin. It's going to allow those abdominal muscles to separate apart a little bit. Sometimes a lot, but more commonly, it's not too severe, okay? So the connective tissue becomes more lax, thins, and that's why the abdominal muscle separation occurs. It's not that your abdominal muscles are torn. It's not this crazy separation that is happening from that connective tissue. It's just that the connective tissue thins, widens, and that's why the appearance of the abdominal muscles separating has occurred. Again, really smart function of the body so we can grow and carry a baby to full term in our bodies. So don't stress, don't freak out if you think you do have diastasis recti and abdominal separation. Pretty much everyone who's pregnant will have diastasis recti. Of course, it can heal extremely well postpartum. You might not have a gap at all, but there's lots of postpartum bodies that still do have a separation, and it can be very normal. So first of all, we need to know if the diastasis is actually severe, if it is causing an issue. If there is a gap between your abdominal muscles, it doesn't necessarily mean there's an issue. What we're more concerned with is that connective tissue I was speaking about, the linea alba. If there is good tension and quality in that connective tissue. What I mean by that, when I assess a postpartum belly, or when I was assessing myself postpartum, I'm almost a year postpartum, my baby is a year next week. When we assess postpartum, if I press the fingers into the abdominal wall, into that linea alba, I want to feel resistance back against my fingers. Not this bulging out, but if I press into the linea alba, I want to feel like there's something pressing back. Not that I can push extremely far into the belly. And that's going to be common in early postpartum, especially too when the abdominal wall is just really loosey-goosey. We can usually press in, definitely to some degree, into that linea alba. But as we get further along postpartum, as we start really paying attention to our alignment, our breath, getting back to exercise, And just naturally, the body really starts to get more density and tension back in the linea alba. That's what we're looking for, okay? So I don't want you to think that your abdominal muscles have to go right back together again. They really don't. If there's some degree of separation, say 2-3 finger separation, but you have really strong connective tissue that can generate force, that's what we're looking for. So, Sarah, let's get back to your question. What are your recommendations for breathing during heavy lifts? Here's how I coach it. And I want us to think that we're lifting somewhere in the 8 to 12 rep range right now. We'll talk about those low reps and how we change the breathing in that circumstance. But for now, say you're lifting in the 8, 12, 15 range, somewhere in there. I coach the 3 E's. So you're going to exhale, engage, exert. The 3 E's. Exhale, engage, exert. If I am about to pull a deadlift off the floor, when I'm at the bottom, about to pull the bar, I'm going to start my exhale breath. I am going to engage my pelvic floor and core. So I call this core plus floor connection with the women and the pregnant women and the moms that I coach, core plus floor connection. Essentially, it's that you feel this lifting up of the pelvic floor muscles and this deep abdominal tension almost between your hip bones. So the front of your hip bones, you're going to feel like they are growing slightly closer in space together. Your pelvic floor is going to rise up gently. So we have these 2 actions. That's our engagement piece of the puzzle. Last piece of the 3 E's is the exert, and that's when I pull the deadlift off the floor, stand tall to the top, take my inhale breath as I return back down to the floor, start my exhale again, engage, lift the pelvic floor, think about the hip bones getting closer together, and then pull, so do my exertion. So we do those 3 E's in every rep, in every exercise that we do. Again, if we're in that 8 to 12 rep range. So if I'm doing a push-up, I can inhale as I come down, start my exhale breath, engage my core and floor, press to the top. We engage on exertion or the toughest part of the movement because that's when we really need the pelvic floor and the core to be extremely well supported, supporting our pelvis, our pelvic organs, and our low back. Does that make sense? I hope so. 3 E's. Exhale, engage, exert. Every exercise, every rep. Now, other options that we can do. Say that feels a bit awkward for you. You can also try exhaling on the way down, on the way up. For example, if we're in a squat. So I'm at the top of my squat. I'm going to inhale. I'm going to start my exhale breath, engage my core and floor. I'm going to squat down, keep exhaling, stand up, keep exhaling. Inhale at the top, repeat. So 2 different methods. Again, you kind of got to play what works for you. My preferred method personally, not saying that this is going to be the perfect one for you, is to exhale on exertion. So on the toughest part of the movement, I exhale. I lift my core and pelvic floor and do that tough part of the exercise. However, you can also exhale through the entire rep. Inhale to reset and pause. Exhale through the entire rep. One more step onto this though. What if Sarah wants to get back to that 1, 2, 3 reps where she's lifting super heavy and the body has a ton of loading on it and the core and pelvic floor have to respond at a very, very high rate? Here's how I would coach that. I would inhale. I would exhale. I do that core plus floor connection. I'm going to inhale again. I'm going to keep that core plus floor connection though, and it's going to let go a little bit, but I'm going to try to keep it as much as I can. I'm going to start my exhale breath, just a small exhale, and I'm going to do a harder lift of the core and pelvic floor, then do my super tough rep. Let's go through that again because it's a whole lot of steps. So say I'm going for a super heavy barbell back squat. I'm at the top of my back squat. I'm going to inhale. I'm going to exhale, core plus floor connection, lift the pelvic floor, hip bones slightly closer together, And then I'm going to, again, I'm still standing at the top of my squat. I'm going to inhale again. I'm going to exhale just slightly, not that full exhale that we were previously talking about. Exhale just slightly, get a little bit more lift of the core and floor, go through my entire squat motion. And you can do a slight breath hold after that little bit of exhale breath, say 10-20% of your exhale. You could do a bit of extra engagement through the core and floor, hold the breath, come down and up. All this to say, I'm not a big fan of breath holding in exercise. I know it's extremely common in powerlifting type movements, but until I know that the core and floor they're functioning so well, top notch. We are working with a pelvic floor physical therapist who's doing internal assessment. Until I know that the pelvic floor can handle that type of load, I'm not a big fan of breath holding during exercise. So I hope that's helpful, Sarah. Let's see. Andrea, I have diastasis recti as well as a hernia left from pregnancy. I want to strengthen core muscles but need to make sure I don't aggravate the hernia. I already do a lot of targeted core work, but looking forward to any advice she may have here as well. All right, great question. So we have diastasis recti happening plus a hernia, which can go hand in hand. Because as I was saying, that linea alba, that connective tissue on the front of the body, it gets lax, it gets thin. If we're talking about the case of umbilical hernia, this is when it tends to happen during or after pregnancy. Because that connective tissue is just lax down the midline of the belly, so the hernia has a bit more opportunity to happen. So, Andrea, I would love to know what you're doing for targeted core work. If we were working together, I would probably take you out of what we would think of traditional abdominal exercises, crunches, sit-ups, double leg raises, maybe even hanging leg raises. We'd probably have to watch the front planks as well. Hey, Sarah. Yeah, try it out and let me know how you do with those breathing techniques. Andrea, we'd probably take you out of those traditional abdominal type exercises for now, just because I want to see what's happening I would want to see what's happening when you do those exercises and how the linea alba and the hernia are actually responding to that intra-abdominal pressure and that load you're putting on the abdominal wall. In the case of diastasis recti and hernia, what I tend to lean towards are core exercises such as side planks, pull-off presses, farmer carries. Those are what I would consider to be more targeted core work, especially in the case of diastasis recti and hernia. So let's take out that traditional abdominal work if there's things in your program that you're doing right now, such as those. Let's take a bit of the loading off the linea alba directly, and let's train it in a different manner. So again, side planks, pull-off presses, farmer carries, and just lots of good general body weight, not just simply body weight, but exercises that are using the entire body part that Kelly has you doing, squatting, lunging, hip thrusting, pull-ups, rows, all sorts of great exercises that will load the linea alba in a safer manner. What I really need you to pay attention to though is how you are breathing during those exercises. I want you to do those 3 E's. Exhale, engage, exert on every single rep, all right? I want you to do that method of inhaling during the easier part of the lift, exhaling during the tougher part of the lift. I want you to think pelvic floor rising up just gently, hip bones coming in just gently. All right? Let's take the hip thrust as an example. As you come down, bum goes towards the floor, you're inhaling. When you are down at the floor all the way, you're going to start your exhale breath, engage the core and floor, squeeze the bum, lift to the top. That's your exertion part of the movement. That's where I want you to do the exhale, lift the core and floor, do that tough part, okay? So, great question there. Hey, Carol, those are my exact favorite core stuff. I have DR as well. Perfect. So it sounds like you are doing really great exercises to support it and to manage the diastasis and to not increase the severity of it, which is exactly what we want to do. And Carol, I think we have some questions from you, so we'll get to them soon. Carrie, what do you recommend doing for ab work during the later stages in pregnancy? How often? How much? Should it be every day? Carrie, basically what I just said for those core exercises with diastasis recti is what I recommend for later stages of pregnancy too. So we often hear that you should not train your abdominals in pregnancy, don't train them too hard. It's not so much the case. Again, we probably want to forego those more traditional abdominal exercises. The crunches, the sit-ups, the double leg raises, anything where there's this doming of the belly happening. Why do we want to do that? Because in pregnancy, we want to prevent the severity of diastasis recti. Postpartum, we want to heal it really well. So let's just prevent the severity in pregnancy as best we can. A lot of different things we can do, but in terms of exercise, we want to make sure that we're not putting tons and tons of stress outwards onto the linea alba or downwards onto the pelvic floor, the pelvic organs. So later stages of pregnancy, I love tons and tons of glute work, tons of hip thrust, lunge, glute bridging, everything under the sun with mini bands. Basically, how can we load the glutes in a safe manner? Use the mini bands, do lots of reps, get really good alignment, really good form. Love some side planks. Often in the later stages of pregnancy, we don't want to be in a full side plank with the feet, but you can definitely go for short reps or go from the knees. Pal-off presses, farmer carries, those are great variations. Again, squatting, lunging, pulling, those are going to work the core. What I think is really, really important to know is that basically every exercise can work the core as long as we have that breath down really strong, those 3 E's. Kelly, I refer to it as bread loaf. Yeah, doming sounds better. Yes. So the doming of the abdominal wall is basically, if you're pregnant, it's really interesting to be able to see actually. If you're pregnant and you are lying on your back and then kind of curl up or go to sit yourself up from your back, sitting yourself up, you'll probably see this doming of the belly down the linea alba. So it's like your linea alba is popping out. We don't want that to happen so much. Carrie, also one more thing to add with my pregnant ladies, we do what I call birth prep exercises basically every day from 29 weeks onwards. So once we're in the 3rd trimester, we're doing a series of birth prep exercises, which you would think of probably as core work, but it's just really integrating the breath well with glute bridges, clamshells, side lying, thoracic rotations, squats, split squats, band pulls. So we're doing some core work every day. It's really to help keep the body in good alignment and to help the baby get into good position, which is super important. Carrie, another one you said was, once pelvic pressure starts to occur, what exercises should be done? How do we know how much is too much from exercise and how much is from baby dropping into the pelvis? Yeah, it can be really tricky to know because it's just such a crazy sensation towards those later stages of pregnancy. So, to me, I think we know this. I think we can handle this well if we actually do reduce the weight and loading in pregnancy exercise towards those later stages, the last month, the last 2 months. We take the weight down a little bit, at least, probably quite a bit for most people. Once we absolutely get into those 30 plus weeks, 35 plus weeks, we take the loading down, but we just make sure that the breath is really solid to help support the pelvic floor. If you feel bulging in the perineum, so basically the area between the vagina and the anus, if you feel bulging in the perineum, we know that that is too much. One of my clients in the coaching program that I coach called To Pregnancy and Beyond just asked this the other day. She was practicing lots of deep squatting. Fantastic in pregnancy. With a caveat, it absolutely can, it can feel really pressury down into the pelvic floor. So we don't want to do, we want to modify the movements that absolutely are feeling that pressury feeling in the perineum, or exercises that make you feel like you have to pee. If you're running to the bathroom during a rep, during a set, we need to change the exercise probably, modify it in some way. So I think that You'll probably feel, it's really common to feel some pelvic pain, some pelvic discomfort in pregnancy, say in the SI joints or the pubic symphysis in the front of the pelvis. That stuff, super common, and we can manage it with exercise. If it's feeling better with exercise, you're in a good place. If it's feeling worse with exercise, let's adjust. All right, perfect. And I think, Carrie, I also touched on that question you had about at what week gestation should we focus more on birth exercises versus strength exercises. Example, band and body weight versus lifting. So for my clients, things definitely take a turn, not for the worse, for the better. Once we get into that third trimester, things look different in their programs. I didn't, personally, I'll just give you an example, I didn't do much lower body loading with weight from about 33 weeks on. If we just think about it at that point, and I have no idea how much weight I gained in pregnancy actually, but let's say I was 30 pounds heavier at that point, that's a decent amount of loading to have on a body anyways if we're doing things like split squats or maybe a reverse lunge or a paused squat. We probably don't need to load the body with a ton of weight. Absolutely, lots of bodies can handle extra weight, extra loading in pregnancy, but I would say once you get to the early 30s, mid 30 weeks, let's just pay attention. Let's see if the loading from your body weight in lower body exercises is enough to feel appropriately challenging. And then, like I was saying, we focus birth prep exercises specifically from 29 weeks onwards. Okay, Carol, I love this question, and it was a really good one. So do love Jessie and her approach to no stress in getting your body back after baby and a whole body approach to health. Not sure how to say this the right way, but I'd like to hear about encouragement for getting back to increasing how you'd like to feel and feel comfortable doing. So I think, Carol, you're just a bit unsure, right, postpartum about when to start pushing it again, when you can start lifting a bit heavier, perhaps even maybe when fat loss is a reasonable goal. So I was thinking about your question last night when I was working out at 10 p.m., which is not good, not recommended at all. But I was thinking that my workouts now at almost a year postpartum, they don't look super postnatally. They look so different than what they did look like in early postpartum stages. So last night my workout was one arm chest supported row on a bench, Bulgarian split squat, pull throughs, half kneeling overhead press. That was the main strength circuit of what I was doing. And then some tall kneeling Pallof press holds, and then some faster paced body weight squats. So it's different. It's different than it was. It's challenging now, absolutely. So I think that the main point is that your exercises, the workout, the intensity that you're doing in early postpartum absolutely is cautious, 110%. But we definitely can progress through the months postpartum. And again, it doesn't matter. Say you're 5 years postpartum, I still want there to be some progression if you're just getting back into lifting, like any other body. But postpartum, there are some things that we need to be aware of, that we need to know. So I'm just going to read your question here, Carol. Yes, I actually think I'm now sort of done losing, per se, postpartum till I wean fourth baby. Yeah, definitely. 7 months postpartum. Okay, cool. So if you... Number one, you've seen a pelvic floor physical therapist for an internal, vaginal, and anal assessment. Gold standard, really, really important. We know that there is no, say, pelvic organ prolapse, or that the prolapse is being managed very well. You can manage it really well. Your diastasis recti is healing or has healed extremely well. You don't have back pain, pelvic pain, there's no incontinence. Those are really good signs that we can start ramping it up. What I will say for you, Carol, and for myself as well, still nursing, we want to be cautious. We want to be cautious when we're nursing because there's lots of hormonal fluctuations and factors still happening that can make the connective tissues a bit more soft, not have as good a support. And what I am concerned about in that case is the support of the pelvic organs. So the bladder, the rectum, the uterus. That is why this whole message of being cautious in postpartum exercise for new moms is so important, because we want to ensure that the pelvic organs stay supported and that we are not increasing our risk of pelvic organ prolapse when the organs start to droop down in the pelvis. So don't be afraid. However, we need to be aware. We need to be cautious. We need to ensure, number one, that you're using extremely good technique, alignment, and form in exercise. Number two, that your breathing is spot on. Carol, I'd like you to do that 3E type breathing again, exhaling on exertion, so we do know we have good support of the pelvic floor. Just checking the time here. Carol, I've made squat and deadlift PRs like more than before this baby, but I feel better in both lifts than before. Nice. That's great. That's really great news that you're feeling better. So I would just make sure that you're appropriately challenging yourself. By no means would I suggest you are lifting in super heavy weight ranges for super low reps right now. I would just give yourself a solid year of workouts looking a little bit different, with a little bit less loading, with intensity slightly lower than it was maybe pre-pregnancy, and then we can talk a bit more about really ramping it up. But for sure, like in this program that I'm doing now, in this phase of workouts, I'm doing barbell back squats as well. I'm doing some deadlifts, some chin-ups. My workouts look similar to how they looked pre-pregnancy, but I'm still just a little bit cautious with the loading. So have fun with those exercises, play around with them, but just don't go crazy yet. All right, and I think we have just a couple more here, so I'd like to get through them. Okay, Heidi, I'd love to know how to help with incontinence other than just a Kegel, and maybe also how to know if you're doing Kegels effectively and how not to pee yourself when lifting heavy. Such a great question. So here's the deal with the pelvic floor and why Kegels are perhaps not going to fix all our issues. There's a difference between hypertonicity versus hypotonicity. All that means is super tight and lax. Often the case, if you are having some incontinence, is not simply that your pelvic floor muscles are weak. I know that you may have been told that by your OB, your doctor, your midwife. Just do your Kegels, just do your Kegels. But it's probably not going to be the whole story. So postpartum, it's extremely common to actually have hypertonic or a bit too much tension in the pelvic floor, especially in women who are exercising and lifting weights. So all of us, we need to definitely be on top of this. So for example, if my pelvic floor is holding too much tension, and this is me too, say I'm doing a bicep curl. If I just start my bicep curl from here, I'm not going to generate as much strength or as much force if I started my bicep curl from fully out and came fully in. So here to here, not that much force, not that much strength. All the way extended to all the way in, way more force, way more strength. That's how I want you to think about the pelvic floor. If we have too much tone, too much tension in the pelvic floor, the muscles can't actually relax and release and then have this big, strong contraction. They're like here to here. It's not great. We need big relaxation, big release, strong contraction. So, pelvic floor physical therapy, get an internal assessment done. We probably need some release work in the pelvic floor muscles, just like you would foam roll your glutes. We need to get some internal release or a bit of internal massage happening on those pelvic floor muscles so they can generate more strength. So the weakness in the pelvic floor, perhaps that's causing the incontinence, is not just because you have weak muscles. It might be that the muscles are just too tight and therefore cannot generate as much strength. So the way I teach a Kegel, and we do have some Kegeling happening as I was explaining in the breathing technique, it's like a gentle Kegel to support your pelvic floor. So here's how I would teach a Kegel. Inhale, exhale, gently lift the pelvic floor up at about 25% of your max strength. On your inhale breath, you're going to think about relaxing and releasing your pelvic floor. This is so, so important. The tricky part where Kegels tend to go wrong is that people just contract 100 times, and then they're like, perfect, I strengthened my pelvic floor. But unfortunately, you probably just made things a bit too tight, a bit too tense. So if you are practicing any Kegels, I need you to do an inhale breath and feel relaxation. Think about breathing into your belly in your pelvic floor. And then on your exhale, you can do a gentle contraction. But on your next inhale, do make sure that you get that release and relaxation happening. 8 to 10 reps. That's it. That's totally it. Okay. Also, just one last thing about incontinence, and then I think we're going to wrap up from Jamie. Particularly stress incontinence with running or jumping. I need you to make sure in your running and jumping that you have good alignment. I always talk about ribs over hips, your rib cage being stacked over top of your pelvis. So we get our diaphragm over top of our pelvic floor muscles, okay? In your running, in your running, you're skipping, you're jumping, I don't want you to be totally upright. I almost want you to have a slight forward lean. It gives our pelvic floor the ability to create more strength. Don't run upright, don't jump rope totally upright. Slight lean forward, just slightly. You don't have to feel like you're falling on your face, but I want some slight trunk over hip movement. All right, I hope that's helpful. I think that's it. Are there any other questions? Hey Raven, best Kegel cueing ever. Nice. You don't have to do a ton of them, but just know that the ones you do, we want quality over quantity, okay? Not crazy engagement, but just gentle. I think that's everything. Do you guys have any more questions at all right now? My little rascal's probably going to be waking up soon, but so good to chat with you. Your questions were so smart. Baby, yeah, she's just napping. She is just having a little nap, thankfully. Man, oh man, it's crazy. Almost 1 year old, and she's a wild child. Oh, my program. So thank you, Kelly. I write at jessiemundell.com. And then where I coach clients is in a group coaching program called To Pregnancy and Beyond, and specific strength training for all the way through pregnancy, early postpartum, and then I coach just lots of moms in general who have older babes who might be still kind of just getting back into strength training or dealing with some of these core and pelvic floor issues. And then I also write for Girls Gone Strong if you all are familiar with their work as well. So lots of good information around if you need any more. And if you need to contact me at all, you can. My Facebook page is Mundell Lifestyles, Instagram at Jessie Mundell. Find some way to contact me if you need more information though, and I'm always happy to help. All right. Yes, love GGS. Such good things happening at Girls Gone Strong. Okay, you guys, so if you're catching the replay and if you have questions as well too, I can always check back in, or Kelly can let me know if there's anything more you need clarification on. Okay, good hanging with you guys. Have a great weekend. Nice to see you all on here. Thank you so much for hanging out, and I'll chat with you soon. Bye.